Welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, including the PACE program. And today we are going to talk about the PACE program. Locally, it's known as Elder Service Plan of the Cambridge Health Alliance. It's also known as ESP. That's locally, and nationally it is called PACE, which means Program of All-Inclusive Care for the Elderly, beginning at 55. Gives me a little agita to say that, but I have to say it because it's true. And today we have as our guest Dr. Jonathan Burns, who is the medical director for ESP. Welcome, Dr. Burns.
Thank you very much. I'm very pleased to be on the show.
And I'm very glad to have you here. So we're going to talk to our folks out here and tell our folks what we do, basically, and who we serve and how we serve them, and let them know, and all about our expansion, too, because we have moved to new digs.
A lot of exciting things going on.
Very exciting. And, you know, I've been here almost 10 years, and I'm really happy to see this happen. I'm really glad that I was still here to see this happen, you know, because it is exciting, a very exciting time for us. So can you tell us about the type of patient that you serve at ESP?
Well, our patients are very diverse. You know, as you said, there's criteria, there's enrollment criteria, and you know, I think that the most important one is that you know, a patient has to really be interested in our program and believe that they would benefit from our services. Like you said, I think the first really important criterion is the age 55. Mm-hmm. You know, there is interest in expanding. Or older, that's right. I think there's interest in expanding PACE to younger ages, but currently you have to be at least 55 to qualify. And our patients are very diverse. We have patients who are older and have more cognitive impairment, and that affects their life, and so memory
and things.
Right, and you know, our program is designed to really give comprehensive support with a whole team to patients. And you know, I think historically we had more patients who were quite elderly with you know, more often dementia or memory impairment as one of the reasons for being on our program. But more and more we're seeing younger people.
I know, it's kind of scary. It kind of scares me.
Yeah, that's right.
Younger people, but people that require some assist with some of their activities of daily living, like bathing or dressing, grooming, toileting, or transferring. They don't have to be homebound or bedridden, but they do need to require some assist. And we can even sort of stretch it to supervision in the shower, which means that you might not need to be physically scrubbed down, but maybe it's a good idea to have someone in your apartment while you take that shower for safety reasons.
That's right. In our program, we really try to think creatively to help people get what they need, and sometimes that's a very unique thing in order to be independent. You know, our mission is to try to help people avoid going to the nursing home.
And hospitals even, right?
And the hospital.
We can do that.
And the hospital, 100%. But you know, that really starts with independence, and I think traditional insurance models don't necessarily focus as much on functional needs, and often you're in the situation where certain things are not covered. But with our program, we have more flexibility and more ability to be creative as a special Medicare program to meet very specific needs, which, you know, as individuals, I think most of the time we have to really focus on a very specific need, whether that be a certain type of medical device or a certain type of what we call durable medical equipment, like a wheelchair, a hospital bed. Sometimes it could be oxygen, and also the team, the supports, whether that be nursing. Sometimes it's a personal care assistant, and social work,
or even the nutritionist sometimes.
Sometimes the nutritionist is very helpful, is key.
Right.
Sometimes the nutritionist is key in addressing the specific need of that person.
That's one thing I love about the program so much, is that it's based on individual needs. That it's not like a set package that everyone gets what they need, and someone might not need a certain thing and someone might need another thing, and it's tailored to individualism, which I think is fabulous.
Yeah, I think that one of the problems that a lot of elders and a lot of individuals face with standard insurance plans or standard medical programs is that it's very cookie cutter and it's very prescriptive. There's certain it's either covered or it's not, and there's less of an integrated approach, and there's also less comprehensive care. Some of our, we have 11 different disciplines in what we call the interdisciplinary team, including things like rehab and which is OT and PT and speech therapy, the medical team, the doctors and nurse practitioners, the nurses, and we also have transportation,
right?
And activities, social work and activities.
Activities, yeah.
And with this model, we're able to really coordinate care and provide comprehensive integrated care in a way that that just doesn't happen in the normal medical model.
Right. In the standardized insurance plans, basically they operate kind of like the way we always did. You wait for something to break and then you fix it. But we work proactively and preventatively, right? We like to have our people, we like to get to know our people and have them come in so that they get to know us and we get to know them. So maybe if something's not quite right with them, then maybe we start looking and check to see if there's something medically going on with them.
Absolutely, and a lot of times that means care coordination. That you really have one or multiple team members who are following what's going on in a particular realm. Whether it be the status of a medical condition like asthma, or if it's a more functional impairment, like someone who needs an artificial limb, and you have the home environment and the equipment, as well as the general health and this functional status of that person, that all need to be reevaluated and at one time or another, either a physical therapist or an occupational therapist might need to kind of step in and make some minor alteration to really keep the best function and the best safety to help that participant meet their goals. We call our patients or our clients participants because they're participating in our program.
And in their own health care.
Absolutely. In
their own health care. We encourage that at whatever level they're able to. That's a great point. And you have all of these different providers, these different disciplines, that it might be rehab that goes out to work with someone. And by the way, rehab, nursing, and social work with people in the clinic, which is now at 163 Gore Street in East Cambridge, and they work with people in their own homes or apartments. So they get the benefit of both. And we're also available 24/7, 365, only one number to call. But as you have pointed out, that it's the coordination and the comprehension of the care. So it's one team, and we are an autonomous program. There's no other middleman, so to speak, to consult with. So if we say someone needs something, then we get it for them. And if rehab should maybe notice an infection on someone, they consult the medical team, and then the medical team gets right on it. So there's no delay, there's no lag, and I think that's really so special.
And that's one of the wonderful things for me personally about working in this model, is that it's not the typical medical model, which is very much a top-down model, that there's the doctors or the medical care that sort of dictates the next step and the next step and the next order. We're very much a team approach, and so we see each other as colleagues, whether we be a doctor, a nurse practitioner, rehab, social work, and nutrition activities. We see each other as colleagues, and we also go to some very important team meetings together where decisions are made. So a lot of times, even though there might be someone with a very specific training, we take all of our expertise together and we make team decisions,
right.
Which is just a really wonderful model. And it's also a very personally satisfying environment to practice in for me. And we think that it leads to really good outcomes.
Right. It's so true. I know personally, I used to do enrollment, and we make a difference in many people's lives, and that, honestly, I feel blessed to do the work I do because we make a difference in people's lives, and we give life back to some people that might not be able to get out of their home, or that they're not able to get to their doctor, since, as you said, Dr. Burns, that we provide transportation to medical appointments. And honestly, if we're going to send someone to an appointment, if either they come to the clinic and we bring them to the clinic, but even if you have to make a referral to the specialist, all they have to do is kind of show up at their home. We pick them up, we take them there, we pay for everything at the appointment, and we bring them back home.
Yeah, I think that there are many holes in healthcare for many adults, older adults, and I think that we're able to fill some of those holes as a PACE program in a way that helps individuals stay independent in the community. Right. And that's really our mission as a team, as providers, and as a plan. Which is what we really one of the things that we are is a health plan. Right. To our goal is to take those vulnerable clients who might be facing a decline in function or in some cases nursing home placement, and try to address specifically their individual needs so that they can be independent in the community, and for individuals it's a very powerful thing to be able to maintain your independence. I think that there's nothing as difficult and as powerful as the loss of independence, which for a lot of older adults really means the loss of their home, or the facing the reality of having to move from your home. Right.
I do want to mention that a community setting is, whether it's their own private home, whether it's an apartment within senior housing or any place else, or even assisted living or supportive housing, it is all still considered community. It's not institutional. It is all community living, and that's our oldest patient, who is on our brochure, Miss Bridget. We were able to support her until she was 105 in an assisted living situation. That's pretty good.
Absolutely, and we're really experts at making all of the housing options available and individually tailored for the a particular client. So for someone, for one example, assisted living can be a really great thing for some adults.
Right.
It can really just make life easier and simplify.
And safer, and give them a sense of security because there's someone around. There is staff is available 24/7 there, as we are, but we're not right on the site, of course, as the staff in assisted living. When I often tell people when we enroll, they have themselves, they have any caregivers that they have on board, they have our team, and then they have the team at the assisted living facility, and that's 4 levels of care supporting one person to keep them in a community setting. So that's considerable.
Yeah, that's right. And it works out very well in a lot of cases.
Right. So we've talked about the program and who would, and it is a qualification. So, but feel free to call. There is no wrong referral. Ask questions. If you can get me, I'm happy to answer any questions for you. And let's talk about now, because we've grown over the years, and we were in very tight space, and the team did unbelievable work in that tight space, but now we have branched out and we're in new space. Do you want to talk about, I know we have so many more exam rooms and things.
Yeah, I think that the change is just fabulous. As you said, we were previously located in Central Square in a very tight space, which I think made us provide a lot of our care out in the community.
Right.
But now with our newer space, which we've just recently moved into on Gore Street in Cambridge, we have a lot of improvements. I think the building overall is more accessible. It's on one level. The ramp isn't as big, so it's much easier, and the space is just wonderful. There's a very large day center room, which was designed really to have the most windows and to have the to be a big open space to provide a great meeting place and a great activities area for our participants. I've heard overwhelmingly positive feedback from our participants about the center as a whole, but also about the main room, the common space.
The main room, yeah, it's so bright and cheery.
It is,
yeah.
It is, and it provides over twice the capacity of our previous day center.
And the room can be divided in 2 so that we can do 2 groups at one time.
That's right. And there's lots of activities. We have many participants who come in for certain types of visit, like a nurse visit, or to see a social worker. But there's activities going on every day. There's meals that are served. So some participants come in for the meal. There are special activities. Sometimes we have the Nature Connection come in, and music.
Tai Chi is one of the relatively new ones, which is fabulous.
It is absolutely fabulous. It's talk about an activity that can really help you be healthy.
Right, because it's good for balance, right?
That's right. That's right.
And the name of the game is to stay upright. We don't want to be falling all over the place.
Use it or lose it, right?
I ask my people all the time, if you don't use it, and they all answer. They all know that one, and that's true. So we have to keep moving and grooving. Well, that's our new site at 163 Gore Street. But another exciting event will happen in the next few months as construction goes, and that's our expansion in the Malden area as well. so that we will be able to provide care instead of bringing people all the way down Route 16. Well, if anyone has been on Route 16, you know that you could be on Route 16 for a while, and that's no fun. So we have an alternative care site out there, which will help the people at that end of the world as well. So, as you said, there's so many exciting things happening, and now we have 2.5 doctors now. Do we?
Yeah, I think that's one way of putting it. We have a third in the pipeline. We have a geriatrician who is going to join us in September.
And that's a good point. Our docs are all geriatricians. When I took care of my mother, I never knew what material my mother would be for me, but she was great material. 17 years ago, she's gone. But then there were only 2 geriatricians in the city of Boston, only 2. And so my mother was medically complex, and we had to get in line to meet this geriatrician, which she never made it. She never met him. But now, and with the elder service plan, that's what we specialize in. We specialize in the care of folks that have all these medical needs. So we become very expert in that, yes?
That's right. And we're part of the, our medical team is part of the Division of Geriatrics at the Cambridge Health Alliance. And, we benefit from all the resources of the Department of Medicine and the division. And, we're in a good position to expand as well.
Right, and I did want to mention, I'm not sure if everyone's aware, that maybe a year and a half ago, the Alliance has an affiliation with Beth Israel Deaconess Medical Center, which is, there are limitations on what a community hospital can do, although we get all these awards and all these accreditations, I think we're doing okay. But, we have a Boston hospital also in our network for the special things that we might need, right?
That's right. As a hospital network, we the elder service plan is part of the Cambridge Health Alliance. It's
right.
It has a defined medical network. We try to coordinate our care within the network, but like you're saying, we do have a new agreement with Beth Israel as our preferred, our first preferred tertiary care network.
Right. So if we need things of that nature, then we go to them first.
Yeah, and that's usually that's becoming more and more our first preferred outside referral for services that we really can't provide within our smaller network or our primary network.
Right. So it's good to have that relationship. It's good to have that relationship that if we need it, it's there.
Absolutely.
Right. So let's see. What else can we tell our folks? What we can tell you? We can tell you under certain financial criteria for people, they may qualify and not have to pay any premium for this program, and that's a very special thing. But most importantly, that even if they're over that income guideline, they do not have to be disqualified. There is a way for them to still be part of the program. And even if people have oodles and boodles of money and want to come on that program and stay in their own setting, surrounded by their own things and their family and friends, they can private pay us, and that basically stretches out their money, and we're about the third of a cost of a nursing home. So that's also a good point that, I think it's a misconception out here. Let me just say, I know it's a misconception out here that if you don't qualify under the certain level, then you cannot enroll with the program. But we're actually the program that has the most flexible financial ability in enrollment. So
absolutely, and I think that we do have historically many more people who are what we call dual eligible, have Medicare and Medicaid.
Right. Or straight Medicaid.
Yeah. But as you're saying, Roberta, if you were to consider all of the services that you're getting, if you did want to, if you were in the position to private pay, it would be impossible to get the same value with outside of a plan like ours. And there are families and individuals that do that.
Right. So when people get enrolled in our program, they get assigned their own doctor, nurse practitioner, nurse, and social worker. That's their individual team, and then they have access to that larger team that you mentioned, which is very important because people get it's a tighter level of care for people.
Absolutely.
Yeah.
Absolutely. I think that having people, having the team really follow you and develop a relationship over time, we think helps to create a medical home. Right. For our patients, and we think that in the kind of like what's hot and what's new in the medical industry, one of the big concepts is the concept of medical home that pretty much every insurance plan, pretty much every provider wants to start or wants to replicate, and it's really inherent to the PACE model.
Exactly.
We are one of the first, if not the first, true accountable care organization, where we provide care at all levels, and we are also the insurer.
Right, we're the insurer and the provider, and we take care of folks right through to the end of their lives. We never say, sorry, you're too sick, you're too old, you have to go. We follow them right through, and that team that we've talked about follows people whether they're in a hospital or whether they're in a nursing home setting. So we are managing their health care wherever they are, and they're also allowed to be out of the area up to 30 days. And so we are the team that will be called in the event that, heaven forbid, anything should happen. So I just want to leave you with one more thought, and that's our phone number, which is important. The number to reach us is 617-575-5850. So thank you so much for joining us, and I hope that we have given you some good information.
Thanks very much, Roberta.
Thank you so much, Dr. Burns.
And thanks everyone for tuning in. It's been a pleasure.